Welcome to the DevReady Podcast. Thanks for joining me, Max Mito, today. Why don't you introduce yourself and let everyone know a little bit more about yourself?
Sure. Anthony, thanks so much for having me on. I'm half Japanese, half English, grown up internationally. Started StrongRoom in my second year of university with my co-founder, Chris Dure. We were soon joined by Kieran Start, our current director of engineering and co-founder as well, as Mark Velchu, who's the only pharmacist and co-founder as well. The initial idea for StrongRoom came from wanting to use facial recognition to match with people's medical records. What we were doing initially, we were fairly naive about because we found that a lot more things were on paper than we initially thought. We started the business, Anthony, in 2017. So at that point, a lot of nursing homes were still using paper medication charts. Private hospitals are still using a lot of paper to this day. So the idea wasn't quite ready for its time. So we decided to really focus on medication management. And here we are today with StrongRoom AI.
Yeah, it is a interesting industry, the healthcare and the pharmacy space, where the technology is not where you expect it to be. Were you as shocked as I was to find out they're still using faxes?
Yeah, absolutely. I mean, to just put into perspective, I came from like an economics and history background, and I thought that, med tech was this very cool, AI driven back then, sort of on the verge of curing cancer sort of thing. But, the deeper we go in, as you know, Anthony, it's a little bit more. It's one or two steps more behind than what people might think. So,
not in the community pharmacy side. They have their computer for their POS and then probably a TV in the waiting area, and a lot of them, that's it.
That's it. I just recently saw a solution come out that had a proper ticketing system. So, patients, when they come in, knows what the wait time might look like, and innovation.
Right? So interesting how it goes. Yeah, you expect a lot of more probably transition to certain tech in that space, just because it'll make people's jobs easier. But a lot of them, from what I've seen and heard from people anecdotally, is they don't like change, and they want to focus on either the customers or just the business, not that sort of stuff, because that stuff's changing all the time as well. So it's hard to keep up.
Yeah, no, 100%. And I think there are good reasons for why change, hasn't happened as quickly as we, have imagined. And when I say we, the general population, and I think it's because there's so much going on. There's a lot more risk than just implementing like an HR tech software into an organization. So, and healthcare is so unpredictable, as we know.
Yep.
So,
and then there's a lot of privacy and security that trumps everything.
Yeah, absolutely. So
I remember when we were rolling out our shopfront product. This would have been probably 2015-ish, somewhere around there. Yeah. And we went to speak to a group, and they're like, "Oh, do you support Windows 95?" Because they still had stores on that 20-year-old software at that point.
I know. I mean, there's still Windows 7 that we still have to support from time to time, which is, I think, a lawyer's nightmare to decide where the liability sits and everything. But
when Microsoft stops supporting it, it's a clear sign to everyone else normally.
Yeah, exactly. So
I thought we'll touch on your actual founding journey. So you said you started with a partner, and then you brought on a third co-founder. He sounds like he would be, you said engineering lead, so that would be your technical co-founder?
My first co-founder, Chris, is our CTO, and he's quite technical. So his background's in data analytics. I was a self-taught coder at the time. I haven't touched it in years. And then I realized that, it would be a lot more productive if I had a part-time job and could pay someone else much better than me to do it. So that's when Kieran joined us. And then once we had our first product, I showed it to Mark Velchu, who is an industry veteran, and he thought it had legs. So he came and joined us after that. So we sort of considered the four of us to all be co-founders.
Yep. So it's really very technical background then. It's not, I just assumed you were non-technical, but having taught yourself programming would have been quite the feat as well, I imagine.
Well, the one thing I have over Chris is that I won our first ever hackathon in terms of finding a bug, and but he would definitely cream me now, and I would have no idea what I'm looking at. So
Yeah, but it's a good thing then especially because you've got complementary skills in those early days, being able to then find the right spot in the business where you excel. Like you said, finding someone better to do that work, and then you take the work that you actually probably enjoy more, I'm assuming, as well.
Yeah, and it's interesting, as we grow bigger and bigger, the question of focus comes to mind. So you specialize a lot more. And, my job 12 months ago is a very different job to where it is right now. And, for me, eventually I'd love to spend a bit more time on the product side and doing the wireframing, et cetera. But, we've got much better team of designers than me now to do it. So unfortunately, or fortunately, I'm stuck on the commercials. So
You can move back into that design side. You just leave the design for them, but you can work on the features and product and direction potentially,
exactly.
which is probably where you sit partly anyway, I imagine. Being in a small startup, you wear many hats.
Yeah, no, exactly. So, but look, and it's always interesting to see where you've got your special skills and where you need help in as well. So, yeah.
Yeah, my business partner and I made that split very early on. He'll focus more on the business and the client side. I'll be more the technical and lead. I was more of a technical programmer than he was, so split there evenly, and it's worked better.
Yeah.
So again, we still both do many things, but there's a clear line normally.
Yeah, no, same thing with us. And, is probably working part-time during that period was one of the best decisions. Actually, during that period, I didn't think I was very strong at sales. So took myself into doing door-to-door sales for solar panels at one point.
Oh, wow.
So I was okay at it, not fantastic, but yeah.
That's not a bad way to do it. You get paid to learn.
Yeah, exactly.
Paid to learn that skill. So,
I heard other podcasts about, other people that have made it, and a lot of them started doing door to door. And I thought it was probably one of the most difficult jobs to start off with. And it definitely taught me a lot, both about the culture of Australia and, just the art of selling, if that makes sense.
Yeah, I can imagine it would. There's a lot of doors that just get closed in your face. Then you get to getting to say hello in literal doors.
Yeah, you get to hear everything and meet everybody. So yeah.
That's quite the journey. So with the idea for StrongRoom, the idea was spawned, and then did you just start building and then try and take it to market, and then realize that the technology is behind?
Yeah, so as I said, the first concept for StrongRoom was, facial recognition, where your data follows you wherever you go. It got to the point where we built out this app that we were piloting across 6 pharmacies in Geelong. And the guys were like, well, how are you going to get the data? And we were like, oh, maybe we can integrate yada, yada, yada. And they were like, no, so it's all on paper as of right now. And we were like, and then initially they were like, yeah, this is how we record methadone and buprenorphine administration. And that's for people that don't know pharmacy, it's for usually people recovering from opioid addiction of some sort. So we were quite surprised about that. And then the more we dug into it, the more we saw that it was not just an Australian problem, but a global problem as well. So we thought that idea was a bit too early for its time and moved into medication management and a strong focus on controlled drug management as well.
So that pivot was really based on the inability to actually deliver the product that you had envisioned.
Yeah, exactly. So look, I think that, 5 years from now, we might still come back to that original idea. And it's still something I find to be quite neat. And it's, duplicate patient records is still quite a big problem. But even now in 2024, the infrastructure is not quite there yet to deploy that idea. So, So, yeah. Yeah.
So talk about probably a little bit about what the medication management means, just so people are listening understand what does the product actually do for them.
Yeah, so obviously, medication management in itself is a very broad term. Where StrongRoom plays in the space is a very specific part of that journey. So we don't. The way that we really analyze things is that we look at things that have either not been done at all or not been done well, and what we look to do is effectively consolidate it. So we've got what we call two generations of products. The first generations of products is really about improving workflow tools within pharmacies, aged care facilities, and hospitals. And a lot of that's around automating controlled drug management. So controlled drugs are generally drugs that are the most dangerous. So opioids, stimulants that could be abused in a in the black market. So that sort of medication. But we've also really focused on professional services, and what that means is, obviously, so professional services are things that the pharmacist will do to manage a patient with a chronic condition. So I mentioned at the very start opioid replacement therapy. So a pharmacist is very involved with managing that patient's intake of synthetic opioids to help them hopefully stop taking opioids after, some time has passed. So, yeah.
Okay. And with what I know about the pharmacy, are you integrating with like the dispense systems to understand the information and then be able to gate things, or?
Yeah, and sorry, and I was going to go on to the Gen 2 side of things, but that's where effectively we've got our Generation 2 product suite. So we integrate with all the dispensing software, whether it's Fred, Zed, POSWorks, Minfos, whichever one that's out there. What Gen 2 now does is looks at all the data that is within the workflow, as well as what we get from dispense, and project out and what are the barriers for the patient to be adherent. Is it a cost-related issue, convenience, etc.? And at that point, it recommends what actions the pharmacy can do to improve adherence effectively. So, and it's really interesting now to be able to play with data and to see how that's improving outcomes very quickly. So, yeah.
So it's in a simple way of explaining, it's sort of taking out the guesswork for the pharmacist to try and remember or find the paper records of what they've talked about with this patient before, what they've discussed, what they've prescribed, not prescribed, but dispensed.
Yeah, correct. And so, I think it's, as you're saying, taking out the guesswork and, taking out the need to remember the different thousands of things that's out there. So,
And are you probably removing the issue of a patient trying to abuse the system and going to multiple pharmacies and getting a similar drug?
To an extent, yes. But, oftentimes there's now government programs out like SafeScript that does a much better job with us. I think where StrongRoom really focuses on is about making sure that the pharmacist or whoever's using the platform has a consolidated view of the patient information in one setting, and that allows for them to make quick decisions about what to do for the patient. And that's where our Gen 2 product suite is really accelerating that. So you might have a patient, for example, on diabetes medication and high cholesterol medication, and you can see from their previous behaviors that they're skipping, months of refills. And some of the reasons why might be, for example, a cost-related issue. So then what the AI does is match them with a clinical trial, for example, that could potentially offset that cost.
Yep.
And so that's where we might improve adherence. And all these tools are available to the pharmacist, but it's always very difficult to keep track of what's out there, what's available. So, that's where we can catch errors from happening or provide a new service that's out there. So, yeah.
I can definitely see the value for a pharmacist in using that product.
Yeah.
So in this say 7-year journey that you've had one big pivot. What are some of probably the core challenges you faced along the way that either stopped you pivoting in another direction altogether to get you to this point?
Yeah, so I mean, I think the question is, what haven't we gone through, to be honest? Yeah, I mean, I think building a company, as you would know, Anthony, has like its very highs, but it has its, big lows as well. So, we've probably made every mistake under the sun, and we've been very lucky to have stakeholders, whether it's customers or shareholders, always support us on our journey one way or the other. I would say that one of the biggest difficulties we've had has always been around customer support and, making sure that we can implement. Last year, we went through this issue of growing a bit too quickly, and as a result, our customer support was not where it should have been, and it was quite a emotional time for myself, because we've traditionally been able to always answer the phone calls when someone's come on board, but we were onboarding 200 pharmacies a month at one point, which was kind of crazy. And so as a result, things broke down, and I think the key lesson from how we were able to get through that was finding really good people and investing in the right people at the right time. There's nearly a case that I didn't do that early enough, but, I'd say we've always had fantastic people in the organization, but, we've always made, good hires, I think. And with each new person coming into the organization, it's always reminded me how powerful even one really strong individual is. But it's also on the flip side, if you bring in someone that's not great as well, how detrimental they can be to the organization as well. So, we've gone through both of those situations. And I think, again, something I wish I did a bit earlier was, investing in the right people at an earlier time, because, you never know when you're going to
that's
grow
always
quickly.
a challenge as well, bringing on someone before you need them. Having that foresight would be a great thing, but it's also then a cost management as well, depending on your growth and where you're up to. And if everyone's just putting in a little bit extra, we can still cover it, but we don't need a full-time employee yet, or whatever the situation may be.
Yeah, no, exactly. I mean, and you always hear contradictory advice as well. Someone goes, you don't need someone that's, so expensive. You can just hire a junior person that will be better, or you need someone that's got more experience, but then they might not be willing to do the grunt work. So it's really on a case by case basis. And in some ways, it's only experience that you really learn what happens as part of that. But
and then you only you understand what you need.
Exactly.
As well. It's not, people with advice, they're not in the business. They can say one way or the other, and it will work both ways. But in what situation?
And ultimately, it's on you to make that decision, not anybody else as well. So you got to own it. Yeah.
So with that sort of growth that you had, did you find that you were hitting those ceilings? Was it just because of the people, or was there systems and processes that weren't solid enough potentially, or they were there, but everyone misses a step here and there, or whatever it may be?
No,
I've experienced everything.
It's never, I would say it's never just solely one thing. And, Anthony, I'm sure you've gone through it before, with everything that you've done.
Every day.
So, we definitely did not have the processes in place to grow as quickly. And again, if I were to start StrongRoom again, I would have made a much bigger investment in automating as much of a process as possible. And we definitely had some parts of the business that was very manual. And I think now we've taken the time to do it, where we're seeing a lot of data across our organization. It was kind of hilarious, because at one point we were doing all these data-driven insights for customers that was fairly advanced and innovative, but then, internally it was like one of the most archaic things that you would have seen, where it's like, here's another black box where we're not quite sure what's going on. And, but we're now coming to a stage where we're very focused, and it's definitely from the data and the insights that we're taking the time to collect. And it just means we're becoming so much more efficient on a per capita basis.
Yeah, it's the systems and processes are key, but you have to probably go through a bit of that pain to understand that you think you may have systems, but you don't have them where you need them to be.
No, exactly.
I think that's probably
exactly. Yeah. And Anthony, I think right before you were saying you're working on 4 different projects, if I'm allowed to say that on the podcast, and I think with each one it might get slightly easier in terms of picking up the signals before you need to make that decision on investing in XYZ. But it's still something I'm working out right now. So
it's never an easy thing to understand, especially, how do I want to say, it's not understanding the impact of not making the change, so the opportunity cost probably, and then which is something I have to probably get over as well, is I can do it faster than if I tell someone else to do it. With how much time it takes. That's a big thing I have to learn how to overcome still. After 16 years, it's still a problem.
Oh no, for sure. And I think it's it can always be quite difficult in that regard. So yeah, definitely. I mean, I guess if you get very good at it, then you would be I'd be doing way better than what I'd be doing. But I remember one year when we raised from a venture capital fund, and we looked at our numbers, we didn't hit targets because we didn't spend enough money, which was a weird thing. And then the other year it was not spending the right money in the right way, and yada yada. But it's always lessons learned in that regard. So
or everything you go through is a learning experience, and it's just, are you going to take the right lesson out of it? And hopefully you do, and that moves you forward.
Correct.
That's what everything is. Every day is a different challenge. There's still problems, there's still issues, there's still opportunities that come up.
Yeah, and I think I think it's really important to keep as humble as possible, so you are always open to listening to people. And again, generally the people I found who has the best advice has gone through the journey and done it very well, but have always remained humble because they remember what it's been how painful it is to go through all of it. But there's always exceptions to the rule as well. So
there's always people that talk themselves up. There's one I see on the internet a lot. Have you heard of I think it's Grant Cardone? You would have heard of him as a salesperson. He's got TikToks out now where he's talking to his daughter about, this is how you avoid paying taxes. So I'll pay you a $200,000 salary. You put all this money into a company, buy an investment, and then you live off the interest, off the rental. Okay, how is that advice that's going to help anyone? And just talking about how much money you can give your daughter.
Exactly. I mean, I think that in today's world, not so much in healthcare, but when you're looking at social media, there's definitely a lot of hype, but I think a lot of those guys have not gone through the pain of actually building a business. I don't know about Grant or one of these guys, but the general ones that you see, there's, I think building a business is pretty humbling. Expert. So exactly. So
go to a car dealership and take photos in front of a Ferrari that's not theirs. That's what they do.
Exactly.
You have to. It's one thing to be able to give advice that you've heard from someone, another one to be able to live through it and actually understand the nuance and be able to position. All right, this is what our situation was similar, but X was different, and this is what we did, and you can take some learning out of that rather than saying, this is what you must do because I did it.
Yeah, exactly. I think, I think that internally within our culture as well, we always let people choose whatever decision that they make, but they have to own it. But, the way that, we like to give advice is, this is what I would do in your situation, but if you've got the data to support that, whatever your approach is better, or if you think intuitively it's better, then own it. But, if it's not going to work out, then let's analyze what's going on. And I think that's really at the crux of just building a business, is you just keep refining and listening to what's going on.
It is. And over those sort of years that we've been in business, I've remembered one thing. I don't know where I heard it was, but it was always be the last one to speak.
Yeah.
So I'll listen to everyone's opinions and then say something, where before I would just say what I wanted up front and then that was it.
Look, admittedly, I'm still learning to do that a bit, but it's very powerful. So yeah.
It's hard to be quiet sometimes.
It is. So
there's always been a lot of arguments, or probably discussions, I would say, that sound like arguments with my business partner. We're talking about the same thing, but from two different points and trying to say the same thing.
Yeah, exactly.
I'm sure you probably have that with your co-founders too.
No, definitely. I mean, I forgot what it was, but like we were both saying something else, and it was like one of our senior advisors was also in the room, and he was looking around, and we were like, yeah, don't worry. I know where you're coming from. I know where, is coming from, and that's okay. But we're just going to move forward with what Chris said, because he's got more domain expertise. And so, so you just move on from there. And no, it's good. It's good.
It's all like it's all a learning opportunity.
Yeah.
So what's on the horizons for StrongRoom, and where you headed in your next 7 years? Just saying that.
So we're very excited to be, expanding overseas this year. So, we've just got our DEA clearance to actually expand our product into the US, and got a number of pharmacies there. We've also got a number of pharmacies in the UK, and we've got some partnerships that we'll be imminently announcing, which we're very excited about as well. I think this year the theme is really about focused growth in those two regions. We're definitely going to be we're focusing on independent pharmacies across the two countries as an initial point of focus. And and there's a lot of interesting I'd say healthcare trends that are coming into our favor, especially for our Gen 2 product suite, which is very exciting. And so, I think, as an organization, we're going to be evolving once again. And, I'm looking forward to seeing what we look like a year from now as well. So,
Is it more just an evolution of the product line because the markets are very analogous to each other? Or is it more branching out into some other opportunities that you're seeing through those?
It's a good question. I think that from a product roadmap point of view, we've released, I think, about 3-4 products in the last 2 years. It's a lot to manage, obviously. So we're deciding to just focus on what we've got on hand and expand upon that globally. And we've been very happy with the levels of growth we've seen thus far. And what we've been surprised about is actually how Australia is weirdly in the middle of the UK and the US from a healthcare system point of view, because obviously we've got a national healthcare system over here, but up until a certain point, you've got to pay out of pocket. And that's where private health insurers exist in Australia, while in the UK, the NHS is very much involved in the payment process. And in the US, you've got the exact opposite, where it's effectively a private market for insurance. So, from an academic side, it's fascinating to see how these things are being influenced and what that means for patients. And so, we'll see where it all goes.
Well, there's a lot of opportunity there. And like the scale of America with pharmacies, I think what Australia has in total is a small state. Over there. So there's lots of opportunity. I'm sure you'll see potential product upgrades or new opportunities to add better features based on having a broader pool of customers and more feedback and more data to process.
I mean, we're starting off in Philadelphia, so Pennsylvania as a state. And what was interesting is the entire state is probably about 25% bigger than the entire Australian market combined. And so it's quite remarkable. But, of course, we're also very excited about what's in store for Australia. So, as of right now, we're really looking to consolidate revenue sources that have been, previously untapped within community pharmacy, and we've got a number of pilots. So, we'll be looking forward to announcing that over the next couple of months or so, and, obviously strengthening the role that independent pharmacies play for their communities. So, for us, that mission has really crystallized for us in the last year or so. But yeah, so looking forward to continuing on that mission.
That's good to hear. It's exciting times ahead for StrongRoom, and I wish you the best of luck in those launches. It's not easy to go into another country and launch products, or a lot of travel, or relying on people over there to take the reins.
No, absolutely. So hopefully, we can speak in a year's time that everything went very smoothly, but the likelihood is that it won't. So,
you've got a few years of learnings under your belt to make decisions from the right spot, at least. So that's a plus.
Definitely.
We'll definitely have you back on for another episode and a recap of where things have gone and the heights you've grown to.
Definitely. Well, look, thanks so much for having me on, Anthony. And
it's been a pleasure, Max. If anyone wants to reach out or find out more about StrongRoom and what you guys do, how can they do that?
So we've obviously got our website, so it's www.strongroom.ai, or feel free to reach out to me personally via LinkedIn. And generally, I'm pretty responsive on there. So reach out.
Yep. Awesome. Thanks so much, Max, and appreciate the episode today.
Thank you so much.
Thanks.